our June meeting of the rate study work group. I think you're going to be excited about what you're going to see. First, just a couple of things. So Liz, if you'll go on to the next page. On our agenda today is we're going to go over a recap of the key tasks and timeframes. We're going to look at the inflation factors, wage analysis, the employee-related expenses analysis, and then at the end, we'll talk about next steps. So this is our timeline that we've shared every time. So we're at the end of June. So we have issued the cost wage survey and analyzing and beginning to present survey results. And then starting next month, and we've already been, working up into that as part of the analysis over the next 2 months, doing the rate development process and approval of draft rates. Looking again onto September and November about having public comment, approving documentation, obtaining approvals for the rates, and then into December, where we will target submitting the waiver amendment to CMS and begin their review period. As always, these are the target dates. We so far have done really good keeping to kind of these time frames, but knowing with holidays coming up and just with how tedious the process is, which you will see in just a minute, and we want to make sure we get this right. These are our target dates, and they may slip just a little bit, but I think we've done a really good job so far keeping to where we are. Okay, in the next slide, Liz. Okay, so I am going to turn it over at this point to our partners from Guidehouse for them to begin sharing all of the great stuff.
Thank you. So this is something that you all have seen before. It should look pretty familiar to you all, maybe a little bit more detailed. And we know that we've walked through what exactly a rate build-up approach looks like. So we wanted to show this again so that we could focus where exactly we are talking about today. So as you remember, the rate is built on both the cost of direct care and indirect care. And as we've talked about before, the wages are really the basis of that direct care component. And then all of the other components of the rate are added in addition to those base wages. So things like admin, program support, any other kinds of adjustments. And so the reason, again, that we're showing you this today is what we have highlighted in red at the top, wages and benefits for supervisors and non-supervisors, are what we're going to be working through today. And we just wanted you all to keep this in mind as we're talking about the wages and the benefits, that those pieces are not the only piece of the rates. Rather, they're just one component that will ultimately serve to help develop what the rate recommendation should be. So that's just one thing to keep in mind as we're going through kind of how this one piece of the puzzle fits in to the larger picture. So with that, as Pam mentioned, we're going to be talking about inflation and wages and benefits. We need to talk about inflation in order to talk about wages, and I know that's a really important and exciting topic for you all. And so I'm going to turn it over to Veronica to discuss inflation a little bit further, and we'll go from there.
All right, thank you, Liz. Good morning, everyone. My name is Veronica Ross-Cuevas with Guidehouse. I'll be walking us through our thought process on inflation. So if we could go to the next slide, Liz. So as mentioned, we will be focusing on wages and benefits today. But when we talk about wages, there are several pieces that go into the wage adjustment. And so we're going to kind of walk through each of those pieces today. The first piece of the wage adjustment is the baseline wages, and that is the data that we get either from BLS or from the survey data that you all filled out a couple months ago. But then we need to inflate that baseline wage data. So the number 2 that we see here, kind of the second piece of the process is inflating that data to account for changes in cost and prices over time. And then the third component of the wage data is to add supplemental pay to account for overtime, shift differential, holiday pay, et cetera. And so first we're going to talk about inflation. We'll do it a little bit out of order, but I think it'll make sense as we walk through the presentation today. And kind of walk through the different options that we have for inflation. Thank you. So as we've mentioned, the hourly wages really are one of the main components of the rate model, one of the primary pieces that serve as the baseline. So we really want to make sure to, take everything into consideration and make sure that we're identifying the most appropriate wages, the most appropriate sources of inflation, et cetera. And so when DMS has been considering the different sources for wage data, so that's Bureau of Labor Statistics, BLS data, and the cost and wage survey data, either of those data sources will need to be inflated to make the wages more current. If you'll recall, the survey collected data from the first quarter of this year, so January through March of 2022, whereas BLS data, the most recent data that's available is from May 2021. So either of those will need to be inflated, both during the rate analysis and also into a kind of a future time period whenever the rates would be implemented. And so that's what you can see here in this chart we have on the right. On the left-hand side, you see BLS wages. As mentioned, the most recent data is from 2021. So for BLS wages, we would actually need to inflate 2 times. So as you can see, we would adjust it 1 time to inflate it to the first quarter of 2022. And we would make that adjustment in order to kind of directly compare the BLS wages to what we received in the survey data. And then we would need to inflate 1 more time into 2023 for when the rates would actually be implemented. And so when we're talking about inflation today, we're really focusing in on that first inflation step. And that second inflation step would need to be adjusted in the future later on in the rate study. And so for that first inflation step, we're considering 3 data sources, and we'll walk through each of those with you all in the next few slides. Okay. So the first data source we have been considering for inflation is the Consumer Price Index, or CPI. I think this one will probably be familiar to most of us. The CPI is it measures the cost of living essentially. And so it measures the average change over time and the prices paid by urban consumers for a market basket of consumer goods and services. And the CPI the data is available nationwide as well as regional geographic areas. And the CPI is the most widely used measure of inflation. A good example of that is the fact that the federal government actually uses the CPI when they make their annual cost of living adjustments. And we've included a chart on the right to demonstrate the inflation rates over the past decade or so. And we can definitely see that inflation has been really aggressive in the past year or two, which I know we're definitely all experiencing. Next, we have the Producer Price Index, or the PPI. Whereas the Consumer Price Index was from a consumer perspective and standpoint, the PPI is from a producer or provider standpoint. So this measures the average change over time in the selling prices received by domestic producers for their output. In other words, this is measuring inflation from a provider perspective. The PPI, what's interesting about the PPI though, is that you are able to narrow in your data to be able to focus on the Medicaid population. So it is not as broad as the CPI. you can narrow it down to Medicaid data, and you can also narrow it down to specific industries and services that are very close to HCBS. And so as you can see in the categories on the slide, there are services like home health care, nursing care facilities, residential developmental disability homes that you're able to look at specific to Medicaid to get a better insight into how inflation is working in those industries specifically. And in the chart, you can see that the data has been a little bit all over the place with PPI, depending on which category you choose to focus in on. And then the third data source we were considering for inflation is the current employment statistics. And this focuses on employment hours and earning estimates based on payroll records. The current employment statistics, you are similar to PPI, you are able to focus in on specific types of services. They have a slightly different set of services and industries that you can select from. And the ones we've included on the slides are services for the elderly and persons with disabilities, as well as nursing and residential care facilities. This does include all payers, though it is not specific to Medicaid. So it also includes private insurance, Medicaid, Medicare, et cetera. All right, and to kind of wrap that all together, considering the three different data sources, we did want to kind of lay out some of the pros and cons of each of those, and kind of walk you through what our thought process has been in the data source that we are recommending. One point that we don't include on the slides is the fact that really all of these data sources are, from credible external data points, and they are all updated frequently. So we have, really useful options to choose from here. And just to start off with the CPI, as we've just walked through, the advantage here is that it is a very widely used inflationary measure. And it is, the broad cost of living. However, the downside here is the fact that it might be a little bit too broad for the purposes of this rate study, since we are targeting a specific population and specific services. Another downside is that it does look at the cost to the consumer of buying goods, whereas we are more so looking at this from a, how much is it costing providers to deliver the services. So that brings us to the producer price index here in the middle, which is the cost of providing services from the provider's perspective. Of the three data sources, the PPI is the most representative of the target population, since you are able to narrow your focus to Medicaid specific data and also narrow the focus to services that are very similar to home and community-based services. The downside to PPI is that it's an index of kind of all of the costs as a whole. It's not specific to wages. Which brings us to the third data source, the current employment statistics, which is specific to wage information, employment data from payroll. In the CES, another kind of advantage is that you are able to focus in on HCBS services. A downside to the current employment statistics is that the data can be slightly overestimated because it does include overtime and supplemental pay, which in our rate models, we usually kind of separate those out and add them in at a different point in the process. So that is one consideration. I did want to point out the numbers that you see here at the bottom of the screen. These are inflation rates for a specific point in time, specifically from May 2021 to February 2022. So not quite, not even a full year, but those timeframes are so that we can inflate that BLS wage data in order to compare it to the survey data. And then of the three, our recommendation is the current employment statistics. The main reason here is because for the purpose of this exercise, we are inflating the wages, kind of just that one piece of the puzzle, inflating the wages, which, as we talked about before, the wages kind of cascade into every other piece of the rate model. And so we wanted to focus on that piece, inflate the wages, and the current employment statistics is actually the only data source of the three that focuses in on that piece of the puzzle. And also, gives us at least some specificity in terms of we're able to focus in on home and community-based services as well. As we mentioned before, this is kind of one of the inflationary adjustments. There would need to be another one later on in the rate study process. So that is something to take into consideration. But I know I've been talking for a few minutes now, so I'll pause and just see if we have any input on as far as the thought process and kind of our recommendation regarding inflation.
Veronica,
Hey, this is oh, Steve, go ahead.
This is Steve Shannon with the Mental Health Centers. Obviously, I like the work. I like the recommendation. My question is, will it be reviewed post February 22? Because since then, I think we've seen a pretty significant escalation in fuel costs, not direct labor obviously expense, but there's been other things that have taken place over the last now 4 months that I think ought to be at least discussed.
Yeah, great point, Steve. Liz, do you mind going back to I think the first inflation slide? Yes, perfect. Yeah, Steve, we will definitely be considering kind of data after February 2022. Okay. The reason we have picked February 2022 preliminarily is so that we can have kind of an apples to apples comparison between BLS data and the survey data that you all submitted. Okay. And then that inflation adjustment 2 that you see kind of like the third row, that would be inflating into the future for when the rates would actually be implemented.
Okay, super.
Yes.
Hey, this is Amy. Again, thank you all for this really great information. And I think this analysis is awesome. So kudos. I know we're talking about wages today, but I just had to ask, will we be using the CPI to add inflation adjustments to the administrative costs, gas costs, that kind of stuff reported by providers? The cost of purchasing goods?
Yeah.
Go ahead, Veronica. All you.
Yeah, I think we're probably going to end up saying that around the same thing, but for right now, we were focusing on wages. As we are kind of hinting at, wages end up cascading into all of the other, I would say most of the other pieces of the model. And then we've also talked about the fact that for some of those other pieces, like the administrative factor and program support factors, et cetera, the costs have undoubtedly increased over time. There's no denying that. But whenever we inflate kind of, I don't have the calculations to show it, but when we inflate kind of all of everything that goes into the numerator and we inflate everything that's in the denominator, it kind of ends up balancing out. But Liz, you might be able to expand on that one a little bit further.
Hey guys, this is Claire. I was gonna add really quick, and sorry all. My name is Claire Payne. I'm actually an associate director at Guidehouse. I was just jumping in today because I recently did this whole process on another state. But I was just gonna say that administrative and the program support, when we get to that in later presentations, it's actually determined as a ratio. So it's not just like a solid dollar add-on amount that necessarily needs to be inflated, because it's using the combination of indirect care costs and direct care costs to determine a ratio percentage that gets added on to your inflated wages. So it's kind of indirectly already accounting for inflation because of the inflated wages. Sorry, Liz, go ahead.
No, that's great. I was just going to say the exact same thing about how it's a percentage added on to the inflated wages and therefore is indirectly inflated as well. Amy, does that answer your question? I know you got a couple of answers there.
It does. Thank you so much. I appreciate it.
Of course. Any other questions? I know we had a couple of folks start to ask questions at the same time, so I want to make sure that if there were other questions, we're able to answer them. Okay, well, if you think of anything, feel free to unmute or write it in the chat. Anything else, Veronica, before we move on to looking at that rate comparison?
No, that's it for me. Thank you for those questions.
All right. So as we have now mentioned a couple of times, we are going to now review the wages. As Veronica has already described, to get to that preliminary wage that goes into the rate model, there's a couple of different components. So there's the wages, which get inflated for an apples to apples comparison. And then there's also a supplemental pay component. So the wages that we're first going to look at do not have any supplemental pay included. So there's no overtime, there's no bonuses, nothing like that. We're just going to look at the standard baseline wages. And then later in the discussion, we will look at supplemental pay on top of that. So right now, we're just going to talk about the baseline wages component with inflation included. And so that's why we talked about inflation first, even though the order was a little bit backwards, because there will be inflation already included in the BLS data. So as you all know, because we talked about this last month, there's two main sources that GMS is considering when looking at the wages. So the first would be the cost and wage survey, which is reported directly from the providers. And then of course the industry data. So that's coming from the Bureau of Labor Statistics, or BLS. From the survey, we are using weighted averages. So they're weighted by the number of base hours worked. So somebody that worked more hours, their wages would be more represented in our averages. And then I also wanted to note that the survey wages are calculated across all programs and populations. So we're not demonstrating unique wages per waiver, especially as you'll see just based on the number of survey responses in some cases. That's going to be really important to make sure that we have enough responses to get good results. And then also, of course, we want to understand that sometimes services are the same across waivers. And so we would like to make sure that we're promoting parity. And then, of course, as we already talked about on the last slide, the wages that you'll see here are the baseline wages. So they don't include the supplemental pay. So they're unadjusted by overtime, bonuses, hazard pay, any of those additional enhancements. And we will talk about those enhancements after we talk about the baseline wages. And then, of course, as we just talked about with Veronica, the rates will ultimately be trended forward to estimate and reflect wages at a future point in time that would be closer to implementation. But what we're looking at here for the wages will be the first quarter of 2022. And that's really important so that we get that apples to apples comparison. We're comparing the same time frame for the survey and the BLS data. So results, what you all have been waiting for. So here, just for the first couple of job titles, we've split it into a few slides since we didn't want to crowd this all onto one slide. So the first couple of job titles here on the left, we show, would be the third column. We show the weighted average from the survey. And then on the right, we show the inflated BLS data. The classifications that we're using from BLS are what we discussed in last month's meeting. So we've crosswalked to those categories that we talked about last month. And then for your reference, we also have the number of individuals reported on the survey here listed in the second column. So you can see, just as an example, for chef and cook, there were only 2 instances of reporting of that particular job title on the survey. And so that $16.13 is being taken just from those two reports. Whereas for DSP, that average is taken from 2,683 reported individuals. So I know that there's a ton of numbers on this slide. And like I said, we have another slide that has some additional job titles as well. But so I want to give you all time to absorb and look at these numbers and think about them so we could have some conversation. But based on this, we are recommending moving forward with the BLS mean. In general, the reason being that the BLS mean typically skews a little bit higher, the inflated mean, that typically skews a little bit higher, and we have definitely heard all of your feedback about turnover and retention, how difficult that has been in the last couple of years, and particularly even more so recently. And so being able to pay that higher wage will help with the retention of those more experienced employees. And ultimately, the goal is to help here with retention and turnover. So again, here is a couple of job types, and I will go to the next slide to show it will be the same exact layout, but it will have some additional job types. The weighted average from the survey here in the third column, and then the inflated mean in the last column. Again, with the crosswalked classifications coming from the recommendations that you all provided in last month's meeting. So,
Thank you
go
for
ahead.
preparing this. This is Amy. I definitely understand exactly, how you're coming up with your numbers and all of that, but I think the bottom line is this. A $12 an hour wage for a DSP is still not a competitive wage, right? The goal here is to establish a rate structure that is both sustainable and addresses the workforce shortage and allows providers to offer competitive wages. I think if we all see the signs and we all go out on the street and, right now providers are telling me that if they don't put $15 on a job, advertisement for DSP, no one's applying. So $12.60 is just not sufficient. And I realize that that's what's being justified by the report, but people can only pay what the rates support. And frankly, the BLS data is skewed low nationally because DSP wages are a problem nationally. And so we've got to address that DSP wage. I mean, I think that we'd really be failing the state if we don't.
Amy, can I just point out real quick? So where the 1260 that you're seeing is based on the provider cost and wage survey data, which is why we are recommending the BLS data, which would be the base would be 1513, not the 1260. Okay. We put both on there so that you could compare and see why we chose the BLS benchmark, that data over the survey data.
Okay, thank you.
Yeah, thank you for that clarification, Pam. And Amy, we definitely heard you loud and clear about that circular reference. And we also understand from folks as they were submitting their surveys that they definitely highlighted the fact that, they can only pay currently, what's available in the rate. So we definitely, we're trying to take that into account with that recommendation there. Okay, so actually that was where I was leading. I was going to ask if there was any additional feedback, questions about what we're showing here and the recommendation. I'd love to have some discussion about this recommendation and whether you all feel it's reasonable and the step in the right direction.
This is Steve Shannon again. This slide 18, it looks like the driver hourly number and the chef cook hourly number actually drops.
Yes, so that is true. One thing I want to point out on the chef cook number, the number from the survey is really only being calculated from 2 individuals. And so the fact that there's only 2, folks reporting that job title might make that 1613 not the most reliable number, and maybe not necessarily the most representative of the situation in the state. And so, we do feel okay about that decision, just given the fact that there's only 2 people reporting that job type on the survey. And then in terms of driver, I know it's about a 35-ish cent difference going from survey to BLS. In that case, that is a lower value, but again, we definitely recommend using a consistent methodology. Ultimately, when working with CMS, in our experience, they've definitely appreciated using something consistent so that they don't think that we are just, cherry picking the highest number in every single case. And so using the BLS mean in that case, given that there's only a 30-cent difference, whereas for most of the other job categories, there's a multiple dollar increase. We felt like that was still the appropriate recommendation overall.
I think the implementation at the local level for those folks that employ both DSPs and drivers, the drivers are going to be unhappy. Right. And that's going to cause problems at that local level, who will express dissatisfaction of, why is there what looks like, ultimately would be a salary increase for DSPs. I don't think it'd be a salary reduction for drivers. I don't think they're be reduced. But if this is the used to derive rates at that point, does the transportation piece become more challenging than it currently is? And again, I understand the math, I understand how it works out, but drivers aren't going to look at the benchmark. They're going to say, and eventually they'll see this.
Well, Steve, I think too, we have to look at, so what service really coordinates with the driver? Most of the transportation, with the exception of the PDS portion of transportation in SCL, which is very minimally used, and I think we're looking at that too, because there has to be reasons behind that, correct? But it's not, most of those it's going to be your DSPs that are, because part of the services that some of them provide involve taking people into the community. So I think that it's kind of rolled into the other services too, where I don't know that we have specific just driver services where that's all that they do. So I mean, they most likely are all going to be billing at that DSP rate. And then the chef cook, that one again was, I mean, really that would be, so you may have that person at an adult day or at a group service, or have that, it may be rolled into home delivered meals, but because that's the one where you have the lower
Right.
drop. But I don't know that we are going to see it that much, unless you all can tell me if I'm just like completely skewing that and I have forgot a whole segment of a service. But I think most of those types of duties are really going to be more you'll see the direct support professionals utilizing
Yeah.
that.
If that was the case now though, Pam, wouldn't that number be closer to 1260?
I can't, well, without understanding, well, the chef cook, we had 2 people respond to that.
Yeah.
Driver,
I mean,
I
chef
don't
cook
know.
is not enough, but 119 for the driver.
Right, so so if you all can, and I know that obviously not all of you all don't represent, and may not be any of y'all that represent the 119, but what was that, I'm wondering, is that providers that maybe also have an NEMT number and they included that, or you know, we can take a look at who reported that. But yeah, you're right, 119 is a lot of surveys.
And I guess there's just a couple of things I do want to mention as we're talking about this. So one is, these are just the job titles that were reported in the survey, not necessarily the service. So exactly what Pam is saying, if there are, we did see that quite a few DSPs are providing specific transportation services. So that wage would then, of course, be included in the DSP wage. And then the other thing that I want to include is that none of these numbers here include any supplemental pay. So there's no overtime included. There's no hazard pay or shift differentials, bonuses, anything like that at all. And we're actually going to talk about that next. So the wage that will be included in the rate development will actually continue to increase a little bit, which we'll talk about in a moment. So that might be something, maybe we want to, you know, continue this conversation after we look at those increases as well.
Very good point, Liz. Thank you. I even still forget that this is just the base now, that we have to do all of the buildups on that to see what the rate actually looks like. So thank you.
I know there's a lot of moving parts here, so, but I don't want to shut down the conversation. Definitely really open to hearing all of this feedback.
The only feedback I would have on that is it possible that there's a better SOC for that driver category? I don't know. I don't remember that being one we necessarily talked about in our discussions, but I don't know if there was one that maybe we could look at.
Yeah, that's a good point, Amy. We can definitely go back into BLS and pull the data and see if there's anything that might be more appropriately aligned with that job title.
All right, Liz, if you all want to go, and I can't remember if you or Veronica that was doing this part. So I guess we're, yeah. So does anybody else have any other feedback?
All right, well, we do really appreciate this commentary, and let's keep it going as we move on to the supplemental pay adjustment. So again, you've already seen this a couple of times, but just to reiterate, to get to that preliminary hourly wage, as we said, we're recommending the mean BLS wages, but inflated to the survey time period, so February of 2022. And then we add in a supplemental pay adjustment. Like we said, this supplemental pay will be reflective of shift differentials, hazard pay, bonuses, overtime, all of these other aspects of the payment that we recognize is quite important. So one thing I want to note here is that on the survey, we saw 62% of providers report that that they pay supplemental pay for one or more job types. So that is definitely a majority of providers. And because of that, we really understand that providers are relying on some kind of supplemental pay in order to get the wages where they need to be. But the supplemental pay that was reported had really wide variation. So some providers were really heavily relying on supplemental pay, while others just had a couple of percentage points to increase. And so again, very similar to what we did with the baseline wages, we're going to compare two sources. Those sources are, again, the survey and BLS data. So here we have the results from the survey. This would be the ratio overall of how much is total supplemental pay out of the entirety of pay for each job type. And so overall that resulted in a 2.71% ratio when we exclude outliers of greater than 15%. And then the reason that we're excluding outliers, one is we definitely want to reflect in the rates a reasonable proxy, and we want to make sure that the rates that we are moving forward with, that they don't necessarily require, we don't want to memorialize that everything needs to be paid via supplemental pay. And of course, it's up to the providers how they would like to pay out the rates and pass on to providers. But we want providers to be able to pay those high baseline wages. So that's why we felt like it was important to exclude those 15% outliers. So again, that resulted in a 2.71% ratio from the survey. And if we look at a comparison point from BLS, BLS has a specific data series called the Employer Costs for Employee Compensation. And that really allows us to break down the costs into a variety of categories, but one of those categories is supplemental pay. And it's specific to Kentucky on a quarterly basis. And we've already talked about the things that that is covered under this supplemental pay adjustment. So here we're showing a 5-year trend for supplemental pay from BLS. And if we look at this 5-year trend, the ratio that we get is a 3.64% amount of supplemental pay in comparison to that 2.71% from the survey. So looking at that ratio and comparing it to the survey results, we are recommending moving forward with the supplemental pay percentage from BLS, so that 3.64%. And that is for a couple of reasons. One is noting that 62% of providers are reporting some kind of supplemental pay. That's a lot of providers reporting supplemental pay. So we know that it's important, and that definitely means something when we're looking at a higher versus a lower number. But also this BLS data, what's great about this 5-year trend is that it's pulling from pre-COVID and COVID impacted data. So we can, thinking about how these rates are meant to be 5-year rates, it's nice that we get both time periods of data, and that might help, that might be a more realistic number for what we're looking at in the future. And I guess one other thing that I'll mention is that the supplemental pay, like I said, was from the survey was a little bit lower than what we're seeing in the recent industry trends from BLS. And so that, again, is just why we are recommending that 3.64% from BLS as a supplemental pay adjustment. So I know I just threw a ton of numbers at you. Again, I just want to pause for feedback or discussion to see if there's any thoughts, questions, comments on what we just talked through on that supplemental pay adjustment.
Steve, Shannon, I may have more questions when I can see the PowerPoint and really study it. I think that might help me.
Okay, absolutely. We'll definitely plan to post it just as we have the others. I know with all of these numbers, it's hard to digest them and be able to ask questions immediately. So we will definitely plan to post this on the Medicaid website.
Thank you.
Yep. All right. So we've talked about the baseline wages, we've talked about inflating, and then we've talked about supplemental pay. So now we're just going to show you the results of what that looks like when we put that all together. Here we go. This is for non-supervisors. We are essentially adding that 3.64% on top of that inflated BLS wage that we talked about in the prior section. So really that supplemental pay is now added on top of the wages that we showed. So all of the wages are increasing. So now here we show the wages across the board for the different job types. And again, this is for non-supervisors. But we also need to look at wages for supervisors as well. And so in order to do that, we want to recognize that supervisors tend to have a bit more experience and they tend to be leaders among their peers. And so what we are recommending there is essentially the exact same formula, but using the 75th percentile from BLS rather than the mean. And so we would incorporate both a non-supervisor and a supervisor wage into the rate in order to develop that final rate recommendation, in addition to all of the other rate components as well. And so again, this higher 75th percentile is really just reflecting the fact that supervisors tend to have that additional experience, as well as tend to be like leaders amongst their peers. Another thing that I want to mention in both of these cases, for both non-supervisors and supervisors, is that these wages are not required to be passed through. So there is no requirement for this exact wage to be paid out to an employee, but rather this is the wage that we're going to use to model the rates, in addition to benefits and admin and program support and any other adjustments. But ultimately, the rate will be the rate, and the system will operate relatively similarly to how it's operating now, where providers receive that rate and then they have the option to do with it what they will. And they can make their own wages, they can make their own benefits package. And so even though this is the rate recommendation that we are putting into the rate, I just want to reiterate that there's not a requirement to pay that specific wage to employees. Again, I know this is a ton of numbers, but I do want to make sure that if there's questions or comments that we have an opportunity to capture those. So I'll pause for a moment.
The only one, these look amazing. So thank you. The only
Yeah.
comment I have is when we talk about, again, just the driver conversation, and I completely get what you're saying. A lot of the stuff reported was probably DSPs. Just think that when this is really presented to the broader provider community, like when this gets more finalized, to really have that talking point down so folks understand that we're not talking about the NEMT drivers.
Absolutely. And we'll also definitely take a look at those BLS occupations as well to see if there's something that might make more sense. Okay.
Hey,
Again,
Liz, this is Claire. There's one thing I was going to add for the team too, and I think you've been saying this quite a bit. Just want to make sure. One of the impactful things is, you know, kind of why we go through so much detail laying out all the pieces is, you know, as we get to the end, Liz and team are going to plan to actually show like full rate models to show you how these numbers plug into the various pieces. And there is a lot of flexibility to change the job type that feeds into a service based on, you know, provider manuals and your feedback. So it could be potential that driver never even gets used because you just decide that DSP is the one that's more accurate for that service. And if that's the case, then we could just cut, you know, driver out of the list. So completely, you know, valid, and we hear the feedback. But yeah, just know that as we go through the process, there is that flexibility because we are being super transparent in our models, that we can easily sub in different job types if needed.
absolutely. Thanks, Claire. So I'm not hearing much additional commentary here, so I'm going to continue on, but feel free to keep unmuting yourself or write in the chat if anything else comes up. So now we are going to move on to employee-related expenses, or ERE, which is also really the benefits model. And I know we talked about this at a very high level last month, but it has been a whole month. So we'll talk about it in a little bit more detail, and then we'll go over the actual results as well. So what goes into ERE or benefits? There's a couple of things that go into this calculation. The first item would be legally required benefits. Those would be things like unemployment taxes, contributions to Social Security and Medicare, and workers' comp. We then have things like paid time off, which could be any kind of paid time off, holidays, sick days, vacation, personal, etc. And then any other components, so insurance, retirement, and then really any other benefits. We know that providers often offer to their employees a wide range of benefits that are specific to that particular employer, to help recruit or retain employees. So in thinking about these benefits, we understand that not all providers have historically offered that full competitive benefit.
Yes, here I am. How are y'all doing this morning?
But we definitely want to make sure that in the rates, we provide the option for providers to be able to provide that full benefits package. We want to make sure that that is baked into the rate so that providers are able to offer that to their employees. And how is it calculated? We have a couple of formulas here, but really the main components to think about are, it's really the cost of that particular benefit, the take-up rate, and the take-up rate is introduced because not all employees that are offered a benefit use that benefit. And so that's where the take-up rate comes in. And then of course the part-time adjustment factor, which accounts for the fact that part-time employees are typically not offered the exact same range of benefits as a full-time employee. So as an example, maybe a part-time employee would not be offered the exact same number of days off. Yes, this does include the retirement system. Steve, I see your note in the chat, and it does. And we'll talk about that shortly. So just to start off with legally required benefits, we have a few different benefits, some of which we are taking the numbers from statute. So to start at the top, we have the federal unemployment tax, which is 6% of the first $7,000 in wages, but there is a 5.4% credit. So that results in a 0.6% unemployment tax. Then we have the state unemployment tax, which is a range for Kentucky. The way that Kentucky does it, it's based on the rating of the employer. So the number that we are using here is 2.7%. That number is within the middle of the range for positively rated employers. And it's also the number that Kentucky applies for any new employers that are not yet rated. And so since Kentucky feels that that's appropriate for new unrated employers and is using that as their standard, we felt that that was what was appropriate to use in our model as well. And that's also on the first $10,800 of wages. The next component is federal insurance, which goes to Social Security, Medicare, etc. And that is 7.65% of the first $147,000 of wages. And then workers' comp, and that number is coming from the survey. So we are taking an average of what employers in Kentucky pay. And currently that's about 2.4%. And so when we put all of those together, we get 11.11%. And I just want to point out here, it's not going to add up directly just because I just want to remind you all that, as we said, each component is on a certain amount of wages. So for example, the federal unemployment tax is only on the first $7,000 of wages annually. The state unemployment tax is only on the first $10,800 annually. And so it's not exactly a straight addition of these percentages to get to that 11%, but rather we apply it to the annual wage based on those numbers that we talked about in the wage section in order to get to this percentage. Retirement, and Steve, this is I think what you were asking about. So we're taking these numbers based on what was reported about the retirement system in the survey. We have the take-up rate, which is about 31%. The average plan contribution, which is about 3.56%. And that ultimately results in a percent of annual wage of 0.82%. So we show an ERE amount here of $258, but that actual dollar amount, again, would change based on the job type, since the 0.82% of a different wage would, of course, result in a different number. But it is the 0.82% for all job types. So that's what that looks like here.
Okay, and then I don't know if this was asked before, and I had to step off on another meeting. Anyway, on this piece, was there any consideration taken for those employers that are participating in the Kentucky Employees Retirement System? Because it looks like the take-up rate is going to be very close to 100%, and the employer number for this coming fiscal year is 9.97%.
So we did ask about that on the survey and included that here, but we can definitely take a little bit more time. I would want to take a little bit more time to delve into the information we have and see if there's other ways to incorporate that.
I just don't want that to get lost.
Yeah, absolutely. We can review that in a little bit more detail. And where are you pulling those numbers from?
Well, the recent legislation, you know, the CMHCs, and there's some other providers as well who provide wage services, maybe some of the AAAs. We are submit all of our employees to the retirement system. We have some who are not participating, but they may make a decision they have to participate. So that was a recent statute that was passed, and the retirement system makes that decision. And every year they calculate the employer contribution, and that this year is 9.97. And if they make the decision, and you know, one of their standards will be, have DSPs been in the system previously? And if so, then they may direct us to put DSPs in. And that's a non-negotiable number. If we're told, you know, you got to put 200 people in, you have to put 200 people in. It's just not a place where we can go to. So that's both in regulation and statute. The number was discussed, and I think the retirement system will communicate that. So I can get that to you as well. But I can put those numbers in the chat.
Yeah, that would be great. Or link anything. But we'll definitely take a look at that, because right now, if we're including those in retirement, but they should really be legally required benefits, and we're not necessarily. I want to make sure that we're appropriating that correctly.
Yeah, and Liz, this is Jay. And you know, if this is something that's required by legislation or statute or regulation, we'll take that back and work with DMS on how best to accommodate it. You know, once it becomes kind of formal, and that's the expectation.
Okay, super.
Thank you. Okay. It's a very similar story for paid time off. Paid time off here includes holiday, sick day, vacation, personal days, and then really anything else that providers offer. So one example might be time off for jury duty or for voting. Those would be included here as well. As expected, providers reported a pretty wide range of PTO, and that range often differed quite a bit for part-time folks versus full-time employees. But on average, we have 29 days across all the providers in the survey. And that is pretty reasonable, really in line with what we would expect. And so that number, we feel very good about that number, incorporating it into the model. So similarly to what we just talked about with retirement, we have this part-time adjustment factor, and we have the average amount of paid time off, which ultimately results in a percent of annual wage of 8.39%. And then, of course, as we talked about, 8.39% of different wages would result in a different dollar amount. So for DSP, we're just showing that here for illustration purposes. That gets us to $2,641. Health insurance. So we did look at the survey that is shown here in the second column, but we also wanted to look at some external benchmarks. So we pulled data from the Medical Expenditure Panel survey. It's Kentucky specific, and it is actually the largest provider benefit survey in the country. So this is a really significant survey. We looked at data for less than 50 employees, more than 50 employees, and then in total as well. And there's a lot of numbers on this screen, but I just want to point out that similarly to what we did for the wages, is that we applied an inflation factor since the most recently available survey, MEPS data came from 2020. We had to apply an inflation factor in order to bring that MEPS data to the same time period of the first quarter of 2022 for an apples to apples comparison of the survey data to the MEPS data. So everything you're seeing here in gray is an apples to apples comparison of the appropriate time period. And so looking at what we have here, we're seeing an average cost, a monthly cost of $521 from the survey. And then if we look in total across all employee types, we're seeing $804. Similarly to some of the reasoning that we've described in other sections, we're recommending moving forward with the 2020 MEPS data, but inflated to the first quarter of 2022. Again, we really want providers to be able to provide a complete and comprehensive benefits package, especially given what we've heard about turnover and retention. And so we will be incorporating, or we will be recommending to incorporate this $804 monthly dollar value into the ERE factor. There's also some other types of insurance as well. So we have dental and vision.
Hey, Liz, just really quick on the MEPS data.
Yeah,
just one thing to add for the group, and I think we commented on it, but it is actually the most complete source of data in the United States when it comes to healthcare and health insurance coverage. And that's another big reason that we're leaning towards it. Not only does it provide a higher number, right? But it actually, again, it is Montana specific, or sorry, Kentucky specific as well. And so it's not just like, we're just picking it arbitrarily across the United States or something like that. And then just the other thing, and Liz, you'd said this on the wages, and I think it was a really great point. This is intended to be a comprehensive benefit package. If every provider in the state wanted to offer health insurance and retirement and all these things, right? Like that's the overall point. It doesn't mean you have to. So if you wanted to provide higher wages and not, offer the same benefit package, that's completely fine, depending on how you want to draw in your workforce. But that's the idea, is that, with, being able to provide this monthly premium and this combination of benefits, every provider would be able to actually offer that to their employees. But again, not a requirement.
Absolutely.
Go ahead, Liz. Yeah.
That's a great point, Claire. And of course, the only real requirements are, of course, the legally required benefits, whereas the other benefits are really optional. And that actually brings me into this other benefits category. And those are things that are just things that providers have reported to us that they are offering to their employees. Things like tuition reimbursement or gym memberships or stipends for transportation to getting to work, cell phones, anything like that. And, just as providers have that flexibility now, they would continue to have that flexibility to offer those types of benefits if they desire in the future. And so we've taken costs and take-up rates from the survey for those benefits in addition to dental and vision. And then health, this number here is coming from MEPS on the previous slide. So what does that actually look like? I just threw so many numbers at you. What does that look like when we put it all together and actually apply it to the wages? So as we talked about before, the wages are adjusted to incorporate these employee-related expenses. And then, of course, on top of that, we will adjust it as well for program support and admin and, all these other adjustments. And so we wanted to just show you a sample calculation. It's we've only included direct support professional because, of course, there's a ton of job types, but we know how important DSPs are. And so we're illustrating those here, but this will be done for all of the job types as well. So we have that baseline hourly wage that we have annualized to about $31,000. And then we have those percentages that we just calculated on each of the slides. So we have that 11.1% for legally required benefits, 0.8% for retirement benefits, 8.4% for paid time off, and then 15% for insurance and other benefits. So that's what we get. That 15% comes from basically adding up these numbers here. And then if we add up all of those percentages for all the different kinds of benefits, that gets us to 35.3%. Or for a DSP, that would be $11,000. And then if we translate that into an hourly wage, that would get us to $20.47, or annually about $42,500. And so again, this is what would be used as a baseline in the model. We would then, of course, incorporate staffing ratios. We would incorporate supervision ratios, admin, program support, all of those other things on top of these numbers that you see here. So again, this would not be the final rate, but would rather be a component of the final rate. And I guess I will just reiterate again, as Claire mentioned, there's no requirement except for the legally required benefits to offer this benefits package, but rather the idea is to allow providers to provide a comprehensive benefits package if they desire. We want to make sure that they have the opportunity to do so. Okay, so again, I know this was quite a few numbers that we've given you all. So I just want to pause for feedback. I can say it on this slide, but if there's comments or questions, I definitely want to make sure that you all have a moment to ask those.
I think, like Steve said, I need to take a minute to just look at this all over, but I wanted to just give you all praise for the attempt to create a rate that allows providers to offer a comprehensive benefit package. I think that's really quite terrific, and it's obviously been a major hurdle for a while for a lot of providers. So I think this is really going to help employees a lot, that providers, should be able to offer that. So thank you for that.
Absolutely appreciate that feedback. So like we said, we will definitely plan to post these slides as we have with the other work group decks. But that being said, I will pass this back to Pam to wrap us up.
Thanks, Liz. So this is a slide you're familiar with seeing. So we now have worked through our tasks for March, April, May, and June. We are going to continue the model assumptions. So in July, review and update key model assumptions from the previous study. This will be for, as we've mentioned, the data that we had collected that we didn't collect on the simpler survey. And then we'll model assumptions. It may include the program cost, support factors, administrative overhead, productivity, and staffing patterns. And then going into August, we're looking at sharing those proposed rate models and fiscal impact. So again, topics are tentative based on how things are going through, and we may have to adjust those, but we'll let you know ahead of time, and certainly let you spend some time with the deck after we post this today. I realize there's a lot of numbers in there. Okay, and what's our next slide? So then some things we're looking at for changes to future meetings. We're looking at alternative times for next meetings to accommodate calendars going forward. We've talked about the request for increased transparency into the rate calculation process, and we're looking at how is the best time to leverage your time, but offer the needed and important details. We may need to require either more time in existing work group meetings and or looking at additional meetings with subgroups of stakeholder representatives to focus on specific services. So that's just a couple of ideas for you all to kind of be thinking about what, if you would prefer one or the other, but we feel like maybe the smaller work group meetings with the subgroups may work well, because it'll allow kind of some more in-depth discussion and answering questions. We again will also post that information on the web with all of the other meetings. So again, just a reminder of the how to get a hold of us. That we have the Guidehouse email address, as well as our CHFS. Again, don't worry if you send it to one that needs to go to the other. We communicate very well, and we make sure that any email gets forwarded to the right group to answer. If you have any questions or additional feedback from today's discussion, please send us the feedback there, so that we can incorporate that into additional information and can get you back any answers you have to questions. Again, this one you've seen a lot. Again, our email addresses, and then specifically mine and Liz's email address. I think that this has been like the back page, I think, to most of the all of the rate study decks. And then we'll get this posted as soon as we can. I think Kelly's done a really good job of turning those around and posting them on the website really quickly, so that you'll have time to look at the slide. Anybody else have any comments before we drop? I believe we're going to give everybody a little bit of time back, maybe. All right, everybody have a great week and a very safe 4th of July.